Hello everyone. Um, I can see the Kingre in the house. Welcome, Kingre. We had started a topic yesterday, and we said we will manage today. We will manage today uh, menopause. Menopause. We started menopause yesterday, and today we are managing menopause. The topic is still continuing. It's a topic that on weekends, Kish Kish, welcome to the platform. Everyone who is watching, thanks for visiting. We are continuing with the topic of yesterday. Finish. We couldn't finish, and it's important to finish. You can't explain something and you're not giving a solution. You have on weekends. I don't come online, but you notice the topic of the day. I have not. I have not done any topic today. It was just a request. Menopause was a request. This is a month of gastric issues, stomach issues, but menopause was a request. That's why I started talking about menopause. So today we will talk about menopause and the management, the detailed management of menopause, how we can treat or manage some things are not treated, some things are managed. So today what we're gonna do is we are going to manage menopause. You understand, about yesterday we talked about menopause. It is infertility after ages of 45 to 55 years, and this is because of the follicles not responding, or they wither. Is a permanent cessation of menstruation caused by loss of ovarian follicular activity. It is diagnosed after 12 consecutive months and usually occur between the ages of 45 to 55. That was our conclusion of menopause. And initial management of menopause is very important. Menopause is something that you should manage. But if you don't know how to manage menopause, several things might happen that are not good. Families can break. You yourself, you have depression. So we should have uh, the a way to manage. So many people don't know how to manage menopause, but today we are going to learn on how we can manage menopause. Now, there are some things that you should do before you manage menopause. One of the things you should do is assessment. eh? Assessment before management. Age. Uh, Age and last menstrual period is very important. This is about medical and also clinical history. Initial assessment before management is very important. So we will say age and last menstrual period is important. Age is very important. Symptoms, you should check on symptoms like hot flashes, vaginal dryness, and mood changes. So how are the severity of these symptoms? Are they mild or so worse? Past medical history. Do you have hypertension? And do you have diabetes? Do you have cancer? Because as we introduced, when we introduced menopause, you saw there are some diseases that cause early menopause. Family history of breast cancer or osteoporosis is important. These are the questions you should ask yourself, or ask if you are a medic. You should ask a person who is coming for checkup. Drugs history. Which kind of drugs have you been using? Have you been on cancer management or chemotherapy? These are the questions you should ask yourself. Physical examination. Physical examination. We are just on clinical and medical history because they help when it comes to management of when it comes to management of menopause. Blood pressure. BMI, the weight. Weight at times causes someone to have insulin resistance. And when you have insulin resistance, you know you can become diabetic, and diabetes may bring what? Diabetes may bring early menopause. Breast examination is important, and pelvic examination is also important. Pelvic examination is there are some tests. Yes, Roger Skill, welcome to the platform. Uh, Today I could not have the topic of the day, but I'm finishing on menopause because uh, from tomorrow is on Sunday. Maybe we may not do anything. We'll resume on Monday. Now, uh, I'm here at the background and I'm watching a game. Thanks a lot, Roger Skiller. Thanks for watching the game. Now, investigations that someone should do, blood works. The investigations that someone should do when you are undergoing menopause. We saw when in menopause, follicular stimulating hormone and luteinizing hormone from the pituitary gland are released, and when they are released, the ovaries do not respond because there is no oxytocin that is enough. So what do? We check the amount of levels. We take your blood and we check the amount of levels of something called follicle stimulating hormone and luteinizing hormone. Is it? We check if it is above the normal levels. Estradiol levels, are they low? Thyroid function test. Sometimes thyroid can make you become have menopause. If you followed well on our topic yesterday, you saw these hormones. They can make you fall into menopause at an early age. So these are the hormones that we check when you start exhibiting signs of menopause at an early age. Follicle stimulating hormone, luteinizing hormone, estradiol levels, thyroid function test, bone mineral density. All those are the tests that we do when we start suspecting you're getting into menopause. You check it out. um, we are just on initial test. We have not gone into management of menopause. We have not gone into management of menopause. Physical examination and lipid profile. Lipid profile, we are talking of the cholesterols. Cholesterols like high density lipoprotein, low density lipoprotein, and the total cholesterols. Those are the ones that we do. Now, non-pharmacological lifestyle management. These ones that do not involve any drug. There are some non-pharmacological lifestyle management that do not involve any drug. These are first line measures for women. The first line measure for women when you are undergoing menopause is diet. Diet is very important. Diet is very important. Increase calcium intake. At least 1,200 milligrams per day. 1,200 milligrams per day. You see, supplementation of vitamin D. You saw how vitamin D and calcium helps when it comes to menopause yesterday. Eat fruits, vegetables, and whole grams. Reduce caffeine, reduce alcohol, and spicy foods can trigger. Sometimes spicy foods can trigger hot flashes. When you are trying to reduce hot flashes, spicy foods makes it more. You start having more of hot flashes, and those are the symptoms that we are trying to reduce. You see, foods recommended are milk, because milk got calcium, yogurt got calcium, sardines, you see, green leafy vegetables and soy products contain phytoestrogens, the soy products. Now, physical exercise is important. When you are a lady at the ages of 45 to 55, and you get into the gym. When you get into the gym, what do? You reduce hot flashes, improve bone density, prevent weight gain, and reduce depression. Sometimes exercise makes you reduce depression. Eh? Some walking, swimming, cycling, weight bearing exercise in the gym. You see, they help, and they help when it comes to depression, weight gain, bone density. They reduce hot flashes. It's very important. Lifestyle adjustment. Uh, we associate smoking with so many things because smoking introduces something called free radicals in your body. Yes, yoga is good for your kish. Yoga is good for spiritual nourishment. It's very important. If you are doing yoga, that is very important. It relieves the nerves and some things. We had to talk about practices that were done like Ayurveda, yoga. Those are things that I'll introduce you to. Yoga is part of healing, and we will see how it was used to heal some people in the past. Now, we check out on smoking. Smoking introduces some things called free radicals in your system, and free radicals may make your follicles to wither early, and it may increase the chances of you getting more symptoms. So you are just smoking, maintain healthy weight, wear light clothing unless you are in a cold area, you understand. Use cool environments to reduce hot flashes. Use cool environments to reduce hot flashes. Practice stress management. Practices that you get when it is stress management, you get mediation, yoga, deep breathe. You see, yoga, as Kish has asked, that one helps in it comes to stress management. But there are other ways we can help. You see, will cotton garment help? Yes, cotton garment helps. You see, heavy. We have seen heavy clothing sometimes makes you be increase warmth. You see, but light, when it's not so cool, you use light clothing. Yes. Other ways that you can help when it comes to management and a person is in crisis. Sometimes menopause can bring crisis, a lot of crisis, so and you can face it so rough. You can face it so rough. This is other ways. Hormone replacement therapy. This is the most effective treatment when it comes to to menopause. Hormone replacement therapy. Estrogen therapy is important. Estrogen therapy is important. Or everything that happens when it comes to menopause, it's because of one thing. The follicles are withering and estrogen is not coming out. So there is an imbalance between the follicle stimulating hormone, luteinizing hormone from the pituitary gland, and the follicles in your ovaries. So what happens is you should do what? You should, if you are in a crisis of hot flashes, mood swings, and all that, hormone replacement therapy is very important. Margaret in Norway is here. Welcome. Welcome to the platform. Now, what happens when you take a hormone? You are just replacing the hormone that the follicles and the ovaries were producing so that it can balance from the pituitary gland. It can balance so that you cannot get the storm, the problems that comes when you are not having these problems. Now, you estrogen therapy used only in women without uterus. You see, when you have uterus, you are producing some estrogen. We call it estradiol at times. You are producing some estrogen. Hajiway, hi Benjamin Badi, how are you? I'm glad I caught up with you today. Thanks, Hajiway. Thanks. We are talking about, this is a topic that we are continuing from yesterday, and it is called management of menopause. Menopause management. So if you like the topic, please share the like hit the like and share, please, to a person who is undergoing the problem, or a student who is a medical student who needs to learn more about management. This may help. Now, the women who have gone to have gone to this condition, menopause, because their uterus was removed, they are at high chances not to be producing estrogen. Hmm? Not to be producing estrogen. So I will here listening as I hustle. Thanks, Hajways. So replacement therapy of estrogen is very important. It comes on oral tablets. And if you have a question, if you people we have a question, please just come in, ask a question as we continue. Ask a question as we continue. Um, Transdermal patches, you can have a patch of estrogen. Skin gels you can apply. Vaginal creams that have estrogen, and vaginal rings that produce estrogen. This is because of in your brain there is a part called the pituitary gland that produces a hormone called follicle stimulating hormone and luteinizing hormone. So what they do, when the follicle stimulating hormone releases the hormones, they balance estrogen that is produced from your follicles in the pelvic region, and when they balance, it programs a circle. Yes, kish, yes, we will see side effects of HRT. I have been told comes with side effects. Yes, it comes with side effects because they are hormones. So if you overdo, I'm just explaining this. When follicle stimulating hormone and luteinizing hormone are released from your brain, they have a balance, a natural balance, when the ovaries naturally cancer and blood clots. Okay, we will see about cancer and blood clots, kish. Uh, the oxytocin that is released, they kind like balance with what is released from your pituitary gland. But now, when you are using the estrogen therapy, you may not know how your body and the levels that you need, because sometimes these tests are very expensive. So doing them every time needs some time and money. But you see, if they need some time and money, what happens? If it is natural, the body learns itself. Pituitary gland and the follicle, so they learn. But when you are using an artificial estrogen, you may not know. Maybe you are using an artificial gel, and at that time the estrogen is high, so you are adding high estrogen over another one. You get it? That's why we say you should be visiting a doctor every time to balance your levels. I can see it's coming to rain heavily, but it's okay. Let's get the likes, my friends. Let's get the likes. If you are here, please hit the like button and share as you continue. If you hit the like button, I usually say, if you have a channel and you really want to get more subscription, always like people's channel, because they give you impressions. And impression is when someone is watching YouTube and then you are the next. So this person looks and sees your channel. So guys, all of you are my friends. I can see Kish always a friend, King Ray always my friend, Roger Killer, Margaret in Norway, and all that are in the platform that are not even commenting and looking at me. I love you all. I want everyone to live healthy. Okay, let's continue. Now, when you have estrogen patches, what happens? When you have estrogen patches, this is what it does. It reduces hot flashes, improves vaginal dryness. So estrogen is the one which when you introduce it, it makes your vagina supple. Mm? So if you have been having a problem with the dry vagina, if you've been having a problem with dry vagina, for the ladies, use hormonal replacement therapy, get an estrogen patch, get the cream, and you will replenish the vaginal dryness. You see? So if we continue, hello everyone, Barbara's World is here. Barbara's World, we are continuing with we are continuing with management of menopause. So that is it. We have started managing. There's someone who asked about the dryness, vaginal dryness yesterday. Now you know estrogen patches. You can buy a ring of estrogen, vaginal cream, skin gel, or transdermal patches. Transdermal are applied on your skin or oral tablets that reduces hot flashes, improve vaginal dryness, prevents osteoporosis, and improves sleep. Estrogen. But there is another combined therapy. What I'm talking about right now is combined therapy of estrogen and progesterone. Now, there is another one called combined estrogen progesterone levels, used in women with intact uterus. Now, the first one, estrogen therapy. This one is with women who have been removed the uterus. So, if you are a woman that you don't have a uterus, you should use estrogen therapy. But if you have a uterus, you should use combined therapy, estrogen and progesterone. And do you know what progesterone does? It prevents endometrial hyperplasia and cancer caused by estrogen alone. High estrogen levels in women and even men is associated with cancer. A man who has high estrogen levels mostly, uh, yes, Roger Killer, please, yes, very important. Remember to like the video and share. It's very important. Like the video and share. Both one here, those who have hysterectomy should use estrogen because your uterus gives some estrogen, even the follicles. But when you don't have, you need the therapy. But now, when you have it, but when you have it, you should use combined therapy of progesterone and estrogen because progesterone helps to reduce something called endometrial hyperplasia. Imagine when you have uterus and you are using estrogen, you will have double estrogen. So when you have double estrogen, you are prone to have cancer. Even men who have a lot of estrogen, most times they are prone to have prostate cancer. You get it? Because there are some men who have attributes of getting high estrogen levels and they are associated with some cancer. So here, a woman who has is undergoing menopause and a woman who needs therapy, hormonal replacement therapy, you should at least use what? You should use combined therapy that has estrogen and progesterone. So progesterone will be taking care of you not getting what? Cancer, caused by estrogen alone. At least we are learning, my guys, at least we are learning. And forms are cyclic therapy when you are doing it alternate or continuous combined therapy. Beauty, happy Sunday, Dr. Benjamin and everyone. Beauty is in the house. Beauty is a beautiful lady. Go check her out. Even if she doesn't want to be a YouTuber, we will follow her. And we will make sure we love her as our mom here. Very beautiful lady. Yes. Now we are on combined estrogen and progesterone. If you have any question on combination of estrogen and progesterone, please be free to ask because sometimes people becomes uh, confused on how to use combined therapy when it comes to estrogen and progesterone. So Yes, a minute guys, let me talk to someone. Yes, yes, umeenda. Kesho kuna mtu. I'm not feeling okay. Umenotice? So sijui kama utakuja. Fungue tena. Saa 4. Haya. Good night. Now, we continue. The combined therapy is estrogen and progesterone. And we have said progesterone takes care. Please don't just watch. Give this live show a like. Share it. Share it. Let's our moms have help. Share to a mom who is undergoing crisis. You know, most of us we know mom is on menopause and we don't want to help. Now you have the platform that can help. Just share this video. Let your mom watch while she's alone. While she's alone so that she can get help. My likes are going down. Please increase the likes. Please increase the likes. Let's go on and on. Boss 1KE, welcome to the platform. Thank you for every job that you are doing always. J. Kingray, a beautiful lady that smiles. She loves talking slowly and smiling. Let's follow J. Kingray, please, guys. Let's follow. Let's make her. Let's give her a smile. Anyone who can share links of anyone on this platform, let's share the links here. Let's share the links here, please, as we continue. Now, we continue and we say, we have said about the combined therapy and estrogen therapy. The main point here is people who have estrogen therapy are people who have hysterectomy. They don't have a uterus. But the combined therapy is for people who have a uterus, and the progesterone, you have said it protects you from getting some cancers. So we continue here and say um, the combined therapy is a very good therapy and it helps. You can continue with it for so long. There is something called local estrogen therapy used for urinary symptoms. Urinary symptoms is in the vagina. You apply vaginal creams, vaginal tablets, vaginal rings. Treats vaginal dryness. It treats vaginal dryness, painful intercourse, estrogen. Now, if you have dyspareunia, when you are having sexual intercourse and you are feeling pain, you can use estrogen therapy. Get the what treatment would you suggest for bone density? For bone density, kish. When it comes to bone density, it depends with what you are facing. If you have a problem with your parathyroid, you need hormonal replacement or the necessary to do, because the parathyroid gland is what controls the bone density by controlling calcium. If you have been on PPI, proton pump inhibitors like omeprazole, they are antacids, you need to stop them. There are so many things that occur when you are not having a good bone density. So the better treatment of bone density in someone is to go to the hospital, check yes, omeprazole, kish. Omeprazole, if you are in long-term use of this antacid, they will. Gabriel Mwau, welcome to the platform. Thanks a lot of coming. I'm answering kish. If you are on long-term use on omeprazoles, they are called proton pump inhibitors. They interfere with calcium. They interfere with the bone density. So you will become so weak. So when I usually say, if you have a problem, take care of the problem, don't treat symptoms. Don't continue to take antacids and you have a problem that you can treat. You get it? Now, you have asked about the treatment. What about lansoprazole? All those are antacid kish. Lansoprazole is slow releasing antacid, just like the omeprazole. Lansoprazole is just like omeprazole, but it is called slow releasing. it releases the effect slowly and longer. You get it? So we try and know how to use. It's less like ransoprazole and esomeprazole. They are slow releasing. There is no difference. You get it? Now we continue. I think I've answered that correctly. Now, if you have been having a problem of vaginal dryness, painful intercourse, urinary symptoms, and recurrent UTIs, estrogen therapy is better for you. So today we know women, when you want to enjoy sex, making love, you want to enjoy in bed, feel orgasmic and feel nice. You know, making love is a nice thing. There is a difference between making love and having sex. So when you're having that thing and you are dry and you want to feel nice, you can use estrogen therapy if you are in that age and you want really to make it well. And you know, when you're making love with your husband or your person and you are feeling pain, it affects the other person. This makes this person can very easily say health with UTI. Yes, I will investigate about that kish kish. Now I'm a doctor. I'm trying to talk on what I know. Now, the effects of having pain and vaginal dryness does not also affect the woman alone, because even the partner feels bad when he is not enjoying this. Please guys, don't just watch. Give me those likes. Let's give the likes as we go. As you tune in, tell people at least likes so that we get more impressions. You know, likes gives impressions. What's up, Kingre? If you have a question, let's ask, please. Now, the effect of dryness and painful intercourse can break families, because when you are not having food for it is called soul food. If you are not having soul food in a family, your family becomes stale. And when it is stale, what happens? The flavor goes away. So let's give the flavor at this age by giving estrogen so that you can feel better when you are having the soul food. When you are having the soul food and when you are given estrogen, and you start feeling right now, I want to go and cook in bed, and then you become so wet and everything becomes slippery, and slippery becomes very nice. Yes, if you are here or you know of someone who has a problem of dryness and painful intercourse and recurrent UTIs, recurrent UTIs comes because of the dryness, bacteria is penetrating through the dry vagina. Do this. Tell this person to get estrogen therapy. Tell this person to get estrogen therapy. Thank you so much for the loves. I'm seeing the loves are popping in. The loves are coming in and coming in always and always. So we are. Give me a minute, please. Give me a minute, tafadhali. Give me a minute. I come back. Give me a minute. I come back. Sorry guys about that. A hustle of a doctor is always a hustle of a doctor. I There was an emergency cannula installation and I've installed. Let's continue now. Let's continue now. Let's continue, my people. I can see Beauty still locked in. Gabriel Moore still locked in. Kish Kish always locked in. Thank you so much. They King Ray, everyone that is here. Gabriel, thank you for locking in and sharing. Boss One is always my boss. Boss One never leaves me alone. Roger Killer, Roger Killia. Margaret in Norway. Margaret in Norway, thank you so much. So we have talked about these lessons. We have talked about these lessons. I'm sorry when I'm leaving and coming back. You know, I'm in office and I'm working, and I have to give out to the community. And giving out to the community is talking and sharing of issues concerning health. And this is what I'm doing. You see, menopause is an issue that concerns health. And when we are talking about health, when we are talking about health, we are even dealing with mental health. Mental health is important in the life of a person. Why? Because you live a happy life. So we have dealt with someone yesterday asked about vaginal cream, vaginal dryness, painful intercourse. I think that one I have managed it today so well. If you want to retain your 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 vagina, use estrogen therapy. Estrogen therapy, it works so well. This one I've used it to several people and it is working so well. And you see, when you are wet, you keep away urinary tract infections. You keep away urinary tract infections because those fluids, those fluids do what? Those fluids, they kill some bacteria. Now, there are some things that we use when it comes to extreme measures like non-hormonal drug treatment. Non-hormonal drug treatment used when hormonal therapy is contraindicated. You know, there are some um, uh, contraindications of how's you? Hi to Maggie. There are contraindications sometimes when it comes to hormonal therapy. Yeah, there are some contraindication. Sometimes you can just not use the hormonal replacement therapy in 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 when you are having menopause. There is absolute contraindication. These are conditions where you should not even use. You should not even use. Absolute. When you have some cancers like breast cancer and endometrial cancer, you are not supposed to use any hormonal therapy. You are not supposed to use any hormonal therapy. You get it? You because hormones sometimes make cancers to be worse. You see, those are absolute. You cannot. There is sometimes when you have unexplained vaginal bleeding. Before starting HIV, the cause bleeding must be identified. This is not absolute, but when you are having unexplained bleeding, when you are having unexplained good, and when you are having unexplained bleeding, like like endometrial hyperplasia, endometrial cancer, and sometimes polyps, given without diagnosis and worsen. You see, don't just give estrogen or combined therapy. You may worsen the bleeding. You may worsen the bleeding. So I'm not saying that you can just start using hormonal therapy. You check on yourself first. Check on yourself first. My people, I'm seeing the numbers are rising and the likes are still just there. Let's increase the likes, my friend. Let's increase the likes. There is some Complications like deep venous thrombosis. Women, when you are pregnant, you remember DVT. I think we will talk about DVT again. And pulmonary embolism. Pulmonary embolism means clogging of veins at the heart and the heart and the lungs level. Reason is estrogen increases clotting factor. Kish said it. Kish said that he has had hormonal replacement therapy increases. Yes, Kish, you are right. Estrogen is a cause of clotting factors. And you see it is life threatening. And then there is another one called acute liver disease, cirrhosis, and acute hepatitis. These are the issues that you should not use hormonal replacement therapy because estrogen is metabolized in the liver. When you have a problem, you're taking estrogen and you have liver problems, you will worsen the problem because the estrogen is metabolized in the liver. And the process of metabolizing is this. I said it very clearly. When something goes to your liver, it is changed into fat soluble to water soluble so that it can be eliminated from your body by urinating and going to the loo. Anything that cannot be changed to water soluble cannot come out of your body, and that is what we call metabolism. And that process produces heat. So if this estrogen is metabolized in the liver and you have liver disease, you will be causing more harm to yourself. You see, liver dysfunction cause drug accumulation and toxicity. You see, so my friends, and everyone who is watching now, you understand why you should not just start using hormone replacement therapy. You see, if you are a YouTuber and wants to be added on WhatsApp support group, you can drop your numbers. Yes, Rogers, please there is support group for YouTubers, and when you go there, you add yourself, be polite, associate with the other YouTubers well, and get the increase. Now, history of stroke or thrombotic disease. If you have ever had a stroke or transient ischemic attack, you should not use. But there are some relative contraindications that a doctor can say you can use, like coronary heart disease, atherosclerosis, severe hypertriglyceridemia, people who have triglycerides, cholesterol that are high, migraines, headaches with aura, gallbladder disease, endometriosis, special situation recurring caution. You get it, like diabetes mellitus, controlled hypertension, obesity, and smoking. Family history of breast cancer, but you don't have. When you have it, you will not get hormonal therapy. But if you have family history, we can think about it and give you. You get it? Now, we continue on management. Now, everyone should not just start hormonal therapy. You should go through all that I've said before you start the hormonal therapy. It is very important because these hormones might bring problems. You see, like estrogen brings, it increases clotting tendencies. And at times, a person who have liver disease, something like estrogen is metabolized in liver, and then you start taking, you increase the problems. Now, let's see this non-hormonal drug treatment. There are some things that you can do that are non-hormonal and they can help. Use of HRT is contraindicated, hormonal therapy is contraindicated, and now you cannot use hormonal. You are on the part of the people that we have named. You cannot use hormones. What can you do? Antidepressants can help, like fluoxetine. Greetings, everyone. Sorry for late arrival. Oh, smile in the city. Let's smile always as we talk. Welcome to the platform, Smile in the City. Smile in the city. Let's flow with the flow as you enter in. Let's check it out. Let's see what is up now. Fluoxetine, paroxetine, valafloxacin. Those are antidepressants. Those are antidepressants. They reduce stress. Serotonin inhibitors and non-serotonin inhibitors. People that have hot flashes, this can help. Anticonvulsants. Anticonvulsants help to control hot flashes. Anticonvulsants, everyone always, there is this drug that people use always when it comes to menopause, and sometimes say people say when you have what nerve problems, it is called gabapentin. Gabapentin, I know very many people know it. Gabapentin reduces hot flashes. Hot flashes, because hot flashes are as a result of nerves. But there is a secret. If you really want to reduce the hot flashes, what you should really do is you should use vitamin B complex. Vitamin B complex. Vitamin B complex reduces so well and the hot flashes go. B complex. Try B complex and you will feel better. That is a good way of reducing, but you can still continue using gabapentin. Thank you so much for the loves. Thank you so much. Thank you. Sage is very good. Kish Kish, what is sage? Enlighten me on that. What is sage? Now, there is antihypertensive drugs like clonidine. Clonidine, if your pressures are going up because of the symptoms that you are facing, if your pressures are going up because of the symptoms, you can use clonidine. It reduces vasomotor symptoms, clonidine. Eh? Now, management of specific menopausal symptoms like hot flashes, management of specific ones, Rogers Kilia, that one. Rogers, add Gabriel Moore. I see he has posted the number there. Rogers, add him. Hot flashes, you deal with gabapentin, lifestyle adjustment, some antidepressants and hormonal therapy. In vaginal dryness, we have seen vaginal estrogen helps to recover the suppleness, the slidiness, the juicy vagina. Yes, vaginal estrogen. But you use estrogen if you are not contraindicated. If you are contraindicated, you use lubricants like KY jelly, a plant that helps with hot flashes and night sweats. Oh, Kish Kish, I think I'll find Sage I see. And then we have moisturizers. Betty's World. Betty's World is here. Our good mom. We love watching her as she is sewing and listening to some music and talking to us. Everyone, you can have a chance and look at Betty's World. If you want to sew, she's a tailor, yes. If you want to do some uniform for your children and some good clothing, Betty's World is here. Sage tablets. Sage tablets, I'll find out what sage tablets are and I'll talk to about it when I know what I'm saying. Now, mood changes and depression. Here, now, whatever we are talking about, we are just talking about when you are contraindicated with hormonal therapy. Yes, sage plant is in Kenya. I heard it once. I think someone told me about it. I'll find out about it. Now, you do counseling when you have mood changes and depression, exercise, and sleep regulation. There is sleep disturbance treatment, good sleep hygiene, hormonal therapy, and relaxation techniques. You feel like you are relaxing. Prevention and treatment of complications. Now, someone asked a very important question about bone density. How can we prevent osteoporosis when you are in menopause? Calcium supplementation, vitamin D, very important. Vitamin D is a cofactor when it comes to bone density, weight bearing exercise, drugs like alendronate and risedronate. These are drugs that bring calcium and bind back to the bones. We have something, I remember I used on a patient a drug called zoledronic acid, zoledronic, alendronate, and then we have pamidronate. Those are drugs that help to bind calcium to your bones, residronate, so that you can have strong bones. Always be, and sometimes people that take calcium, calcium. Why are we just stagnated on? We are just stagnant here on 8 likes. 8 likes. Someone, yes. Don't worry, the likes will go on and on and on. So someone asked me, why don't you like giving calcium? If your parathyroid hormone is not coordinating well with the calcium that the bone marrow and the calcium that is coming in, you will have wrong bone density. And that is where you start having something called calcaneal spurs. When you are stepping down on your foot, you feel pain. Accumulation of calcium at the wrong place. So for the balance of calcium to be okay, don't use calcium tablets. Always use things that can help to balance and bring strong bones. You can take a lot of calcium and it becomes a problem. You get it? You'll have spurs. Vitamin D, pamidronate, residronate, they know how to balance and make your bone strong. Unless you have done the calcium levels, the bone profile levels, and the bone profile is telling us you have extremely low calcium in your body, you can be introduced to calcium tablets. So we continue. If it is a problem when you have cardiovascular disease prevention, did you say pomegranate? No, it is called pamidronate. Pamidronate is a drug, not pomegranate. Pamidronate. We have pamidronate, we have pamidronate, we have resedronate. There are several. These are drugs that are in hospital, and they are the doctors, you are given under a prescription. They are regulated. What if you take broccoli and groundnuts for calcium? That is better. When you can get a nutrients out of food, it is more better than taking nutrients that is supplemented from the farmers. So take food, nutritional care, take foods that have the same nutrients, and you will be okay. You get it. Now we continue. If you have boss one, that is very okay. That is very okay. Cardiovascular disease prevention after menopause, risk increase due to low estrogen. So when you have low estrogen, what happens? The risk of high cholesterol increases. So management is you control blood pressure, control cholesterol by taking something called statins. Statins help to reduce high cholesterol. Health, diet, and exercise reduce high cholesterol so that you cannot get cardiovascular diseases. Cardiovascular diseases means you are having diseases of blood pressure, and you are having diseases of your arteries because of clogged veins with cholesterol. Alternative complementary therapy. Now, you remember we talked about complementary medicine. Complementary medicine is the assimilation of herbs and our conventional medicine in hospital. So I'm talking of alternative medicine and complementary medicine. Soya beans, they are called phytoestrogens, plant compounds similar to estrogen, those that give you estrogens. So if you need to increase estrogen in your body, maybe you are struggling from dry vagina and pain in having sex, use soya beans, flaxseed, and legumes. They increase estrogen. They are called phytoestrogen. They are called phytoestrogen. Herb remedies like black cohosh, red clover, evening primrose oil. Those herbs help so much. Yeah, to some remedies to reduce hot flashes. Now, flaxseed, yes, flaxseed, that one helps. There is contraindications to, I will repeat as I finish. My 1 hour is going down. So if you have a question, this is the time of asking me any question on management of menopause. If you have a question, please, this is the time. I will repeat contraindications to hormonal therapy, breast cancer, because most hormones have estrogen, endometrial cancer, because of estrogen again, history of blood clots, we have seen estrogen can increase clotting, liver disease, why? Because estrogen is metabolized in the liver. And if the liver is having a problem and you are giving it more work, you will be worse. Unexplained vaginal bleeding, estrogen can increase bleeding. So you don't take something that can increase the bleeding while you are bleeding. And if you have stroke history, you should not do it. But there are some things that, hey guys, I'm waiting for your questions about menopause. I think I've delivered it so well. If you have a question, please ask. There are so many people who are asking me about menopause, and now I've managed menopause as it is. If you are post-menopause, you are undergoing menopausal syndromes, and you feel that you are uh, going away from menopause, you should do breast examination, mammography. You check by ultrasounds, monitor your blood pressure, pelvic examination, and bone density assessment. Bone density is very important. You have seen how why bone density is important when it comes to menopause. So, guys, that is all I have about menopause. We have learned what we can do. At least you can help someone. You can help someone by talking to her with the knowledge that you've gained here. Someone talked today. I did not have the normal topic. You know, menopause was a request. That's why I've come to talk about menopause. It was a request. So there is another topic that I was requested to talk about: hives. Hives. If I find time, I will talk about hives tomorrow. Let me see if tomorrow is a Sunday. I'm just doing it on weekends. I've not been coming online, but because tomorrow is a Sunday, I'll see if I can do hives. And then on Monday, we continue on our normal topics on the stomach issues. The stomach issues is the issues of the month. So, Beauty, thank you so much. Thank you so much for everyone who have tuned it. If you have a student who is a medical student, I'll be so happy to guide Mother's Day tomorrow. Yes, yes, I'll be so happy to guide the student. Share this video, tell someone we learn here something, and mm, we don't have any question today. And if someone is here and has a channel, please follow that person. Follow the channel and watch the videos, because if you just follow someone and you don't watch videos, that 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 following and that subscription is null and void. So as tomorrow is Mother's Day, I thank all the mothers in the house. Smile in the City, what time do you normally start? In weekdays, I do it at 4:30 Kenyan time, 16:30. You can find out where you are, 16:30 Kenyan time, what time it will be on where you are. But if it is a request, most request Kenyan time, normal talks. But for request, they come at 22 Kenyan time. So if you request me to do a topic, if you request, um, I'm a procurement person gaining a lot. Yes, thanks. When you request me to do something, it comes at 10. But normally, if it is a topic that we have programmed, it comes at 16:30 Kenyan time. Find out the time that is your time. So have a lovely time, everyone. Until we meet the next time, be blessed, everyone. And thanks for coming in for me. Thanks for everything. I love you all. Bye. See you tomorrow. Thanks.